Hello, my name is Kevin Chung, physical therapist at West Park Rehab and Diagnostics, where I perform electrodiagnostic testing. You've been referred for this test by your doctor or physical therapist because they suspect an injury involving the nerves, muscles, or both structures. EMG and CV testing is typically done in tandem. Together, they can help us determine what may be going on. The first portion of testing is the nerve conduction study. This portion measures how fast and how well the body's electrical signals travel down the nerve. The second portion of testing is an EMG. An EMG assesses the electrical signals produced by your muscles at rest and with activity. This also assesses the nerve cells that transmit the signal to the muscle. When scheduling for this test, you will be asked about your medical history. Questions may include a history of diabetes, neurological diseases, hypothyroidism, and other pathologies that may be pertinent to testing. We also ask that when you arrive to the testing site that you arrive with loose-fitting clothing, such as t-shirts if your upper extremities are being tested, or shorts if your lower extremities are being tested. We also ask that you arrive without any lotions or oils on your skin, as this will affect the ability for us to test your nerves. If you have a pacemaker, please let us know. We try to stimulate a little further away from the pacemaker, but it is not a complete contraindication. West Park Rehab and Diagnostics has dedicated a large room with soft lighting and decor to create a calm environment. We know there are preconceived notions with EMG and NCV testing. And yes, we acknowledge that some of these notions are true, that this test may be somewhat uncomfortable. But it gives us a better idea of what may be going on with your symptoms, and it's going to allow your provider to make better decisions based on what your symptoms may be. You will probably lie down for this test. Occasionally, we will perform this test in a seating position if needed. I will be using a stimulator and skin electrodes to record how fast your nerve is moving. You will most likely experience some light shocks that will become more intense. I will most likely test multiple nerves on the affected limb as well as non-affected limbs for comparison during this part of the test. The second part of the test, I will use a small pin, insert it into the muscle and record the electrical activity that is produced. This procedure is generally well tolerated but can produce a brief couple pinching sensations. This test typically takes 2 hours to complete. We recommend that you bring someone with you who can drive you home if needed. So again, my name is Kevin Chung, physical therapist at West Park Rehab and Diagnostics. I'm here to provide you with the most useful and comfortable EMG test possible. Thank you for choosing West Park Rehab and Diagnostics. We look forward to helping you.